Hi, it's Jeff Rouse from San Antonio with an expert tip. My tip is follow the rules. So what does that mean, follow the rules? Well, people ask me all the time, how can I start doing more predictable dentistry? And my answer is always the same, follow the rules. You see, in restorative dentistry, everything we do has an error associated with it. But if you don't follow the rules, you magnify those errors until you finally end up with a crown that simply doesn't fit. So let me give you a handful of examples that might impact your practice. The first is simple, stone. You know, trying to turn an impression into a cast requires the use of stone. But if you think about how you utilize stone in your practice, do you know what the right water to powder ratio is? Before I left my practice the other day, I opened a box of stone and this was what was in top. Well, that same piece of paper has been on top of the stone since I was in dental school in the 80s. I never really looked at it until the last 10 years. And you know what's in there? It tells you what the proper water to powder ratio is. And you ought to be using it in your practice. So in my world, we measure the amount of stone. We have a graduated cylinder showing us how much water to use. And in fact, we have distilled water because that's the type of water that ought to be used to mix stone. Second example, impression materials. Well, the easy one is polyvinyl siloxanes hate moisture. So you've got to have a technique to get all the moisture out of the way before you even begin the process of making an impression. But the one that's a little more difficult is, what's the working and setting time of your material? If you don't know it, you're not going to be getting accurate impressions. The working time is the point in time where the tray has to be in the mouth, and the setting time is the minimum amount of time that that material can stay in the mouth and actually recover elastically while being removed. If you don't know it, you're never going to get it right. And even if you do know it, unless you set a timer to tell you you didn't violate the rules, you don't know if you got it right that day. So, can you look at an impression and tell if you violated the working and setting time? Absolutely not. The only time that it will come back to bite you is when you're trying the crown in. Third example, reduction burrs. Now, I've got 3 points here. The first is every clinician needs to know when they're prepping a crown or they're prepping a veneer exactly how much reduction is required for that restoration. You need to know that before you start cutting on the tooth. Second is you got to use reduction burrs. All these famous dentists that you see at symposiums showing you beautiful dentistry, they all use them because no one can freehand and get it exactly right. And the third is you got to use the right burr. It drives me crazy when my residents say, yes, I know how much to reduce and I'm using a reduction burr, but the burr has such a huge amount of taper in it, they simply don't know what they've got when they put the burr to the tooth. Last is going to be face bows. All that complex dentistry we talk about in treatment planning sessions can't be done if the maxillary cast isn't placed on the articulator correctly. Now, I use the term face bow generically. It can be a stick bite, it can be a Coist dental facial analyzer, or it can be a traditional face bow, but you've got to replicate the cant of the maxillary plane onto the articulator, or you simply have an error that cannot be overcome throughout the rest of the care of that patient. So, 3 points when you go home. First point, learn what the rules are. Second point, train your staff in those rules and tell them about the importance. Every 6 months I stop my office for an hour and a half to a half day and we go over the rules again. And the last is, don't stray from the rules. Just because it's not new anymore, don't start violating those rules.